Now, this is the unfortunate part about metabolic syndrome, and it's really what I want to emphasize on today, because unfortunately with metabolic syndrome, there are no immediate symptoms. And I know this from personal and clinical experience, because about 5 years ago, I too had metabolic syndrome. And the kind of symptoms that caught my attention was the weight loss resistance. Despite diet and exercise, I could not lose weight. So those are one of the first symptoms that I know is very highly related to insulin resistance. Doesn't mean that if you're overweight you have metabolic syndrome, but that's really one of the first symptoms that bring people into the doctor's office or have them seek care, but someone that's trained to recognize it will realize that they may be overweight because of insulin resistance. And in future videos I'll go into how that happens, but right now I just want to talk about some of the common symptoms that I've experienced personally and with the clients that I work with. Okay, so that's the first one, is weight loss resistance, and it can also be determined as stubborn belly fat. You may be losing weight everywhere else, but the belly doesn't go away. That is also a big sign of insulin resistance or metabolic syndrome. And other things that correlate with metabolic syndrome, again, is risk factors that put you at risk for diabetes. So people who are pre-diabetic are maybe considered to have metabolic syndrome. And when you're pre-diabetic, you have the elevated glucose and insulin levels. So again, if you're pre-diabetic or been diagnosed as pre-diabetic, you may also be in that category of having metabolic syndrome. And a lot of other issues or illnesses that go with metabolic syndrome or insulin resistance. And that's things such as PCOS, which is the leading cause of fertility in women. And for men, it's erectile dysfunction. So this is all because of that cascade that insulin causes when it's elevated. And there's other factors as well, such as fatty liver, because elevated insulin does affect the body's ability to detox correctly. So if you have fatty liver and gallbladder issues, some of you maybe have dealt with gallstones or may have had your gallbladder removed, but you were not told that it may have been due to metabolic syndrome. So these are some common symptoms that I've seen, and I've experienced a lot of them myself. And I'm just going to throw out some other ones that I've seen. Fatigue after meals, sugar cravings, joint pain. And the reason why this happens is insulin is extremely inflammatory, and these inflammatory conditions can exacerbate a lot of the joint pain that you have. So it may either cause joint pain or exacerbate joint pain because it's very inflammatory. And it's also been linked in some studies that insulin resistance can trigger certain types of cancers. And I've seen in research that insulin resistance can increase your risk for colorectal cancer and breast cancer. And another one is fatigue. You know, there's fatigue after meals, which is really a telltale sign of prediabetes or insulin resistance, but also just general fatigue, because you know, instead of using the glucose to produce energy, you're using energy to produce fat. And that's why a lot of people that have metabolic syndrome are fatigued all the time. And other things that I've seen with metabolic syndrome are sleep issues and headaches. So again, when a lot of people experience these symptoms, a lot of us may try to change our diet or take a supplement or a pill to suppress that symptom. But when you start thinking about the combination of the different symptoms that I discussed, then you may have to consider the fact that you may have metabolic syndrome. So please, this video was based on one of the questions that I received. So what are the symptoms of metabolic syndrome? And I hope that answered your question. So please, I want to use your questions to produce more informational videos. So if you have any more questions about metabolic syndrome, please let me know, and I'll be happy to create a follow-up to this video. Thank you for watching.